Right, hello everyone. This is us live again from Mind the Bleep. I can see that there's a good number of people here at the moment, but I'm just going to give it another 5 minutes just to allow enough people to join. So we'll be starting at 8:05 UK time. Right, okay, so I think we'll go ahead and start. So thank you everyone for joining us again. This is one of the urology series sessions under Mind the Bleep. And today's topic is going to be covering lower urinary tract symptoms. So I'm going to hand over to Anthony just now, who's going to be discussing the topic with you all today.
Thank you very much. Thanks, Zach. Can everyone hear me okay? And can you see my slides? Is that a yes?
Yeah, that's fine.
Okay. Hello, everyone. My name is Anthony. I'm an FY2 doctor in Leeds, and thank you so much for joining us today. I'd just like to take a few moments to tell you about lower urinary tract symptoms. Feel free to ask any questions throughout the presentation. Just write them down in the comment box, and then Zach will pass them over to me. I'm happy to stop the presentation to answer any questions you might have. So let's start off with the case. A 75-year-old man attends your clinic and describes a 2-month history of urinary frequency, hesitancy, nocturia, poor flow, and dribbling. What term would you use to describe his symptoms? And we've got prostatism, high pressure chronic urinary retention, BPE, BPH, and lower urinary tract symptoms. Feel free to answer in the comment box. And I'll give you a hint. This is not a trick question.
Perfect. So if you guys just pop the answers in the chat box and I'll relay those to Anthony. Great. Okay. So we're getting a lot of E's.
And that's the correct answer. So lower urinary tract symptoms is a term to describe a few types of symptoms that are related to the inability of the bladder to either store urine or void it properly. It can occur in both men and women, and in men, the greater the age, the greater the incidence of them. They are most commonly in men related to benign prostatic hyperplasia. But they can occur in women as well, especially women over the age of 40, and they are usually caused by UTIs. Now, it is important to remember that whenever you hear the term lower urinary tract symptoms, you don't immediately think of the prostate and an enlarged prostate causing them, because they can be caused by pathology of the prostate, as well as the bladder, urethra, or other pelvic organs. And sometimes even neurological disease, especially conditions that are affecting nerves that innervate the bladder. But they can be also spinal cord lesions, MS, and things like that. But we'll get into that in a moment. So whenever you are taking a history from a patient with such symptoms, it's important to distinguish between the two main types of lower urinary tract symptoms: storage and voiding symptoms. And the way to wrap your head around them is essentially storage symptoms are symptoms that show when the bladder can't keep the urine in. For instance, frequency, instead of storing the urine, the bladder keeps voiding. Nocturia, which is voiding at night. Urgency, when you're unable to store urine long enough and keep having to go to the bathroom. Or incontinence, when the bladder is just unable to store the urine voluntarily and voids without the patient's control. When you think about voiding symptoms, that's mainly symptoms related to the inability of the patient to expel urine. Things like hesitancy, intermittency, so starting and stopping of the stream, straining, terminal dribbling, and incomplete emptying, and essentially a sensation of incomplete emptying. And things that can make these symptoms worse are often caffeine use, excess alcohol, or drinking plenty of fluids before going to bed. So we can distinguish between the different types of causes of lower urinary tract symptoms in males and females. In males, like I've said, benign prostatic hyperplasia is by far the most common cause. They can be also caused by chronic prostatitis or a UTI. And in females, it's most commonly caused by, they are most commonly caused by UTIs, but sometimes can be a sign of menopause or a side effect rather of menopause. But things like malignancy of the bladder or prostate, weakness of the detrusor muscle or its instability, and that's the muscle that controls contraction of the bladder when voiding, urethral strictures or external compression from a tumor in the surrounding area, or a fecal, there's a mistake in the slide, it should be a pelvic tumor or fecal impaction, I apologize. Or sometimes, like I said, neurological conditions like spinal cord lesions or injury to the spinal cord or MS. These are common to both males and females. So that's one of the reasons why the old terms for LUTS, which was prostatism, has been abandoned, just because clinicians should not tend to think about the prostate immediately when they encounter these. There's a range of symptoms, a range of conditions that can cause them, and that's essentially the main take-home message from this slide. So going on to our second case, we have a 63-year-old man that comes in with urinary frequency and urgency, but also some pain in his lower abdomen for the last 4 months. You do a urine dipstick and you find that it's positive for blood, but he has never noticed any blood in his urine. So meaning that he's never had any frank hematuria. So what's the likely diagnosis in this case?
Okay, I'll just give it a second. You guys want to pop some answers in the box? Okay, we got an E, we got a B, getting some C's.
Okay. The correct answer is B. This is a very classic, almost MCQ style question in which bladder carcinoma in situ is the correct answer. It is a type of cancer of the bladder which is very small. However, it can grow very rapidly and is one of the most, if not the most aggressive type of bladder cancer. So it's important not, like I said, to think about the prostate always when you have these symptoms. And the thing here that gives it away is the pain, the suprapubic pain coming from the bladder, and also hematuria on the dipstick, which suggests that the cancer is leaking, the carcinoma is leaking blood into the urine. So it's quite an important case that is associated with LUTS, but isn't related to the prostate. Whenever you have a patient with such symptoms, it's important to take a good history and examine them properly. When asking them about the sort of symptoms that they've been having, it's important to elicit all the voiding and storage symptoms. You should know, you should ask about how long these have been going on for. Have they changed in the last few months or days? Is there a particular time of day that they are affected by these symptoms the most? Do they have any coping strategies? Have they tried anything? Has anything helped? Have they seen anyone in the past about it? It's important also to evaluate the effect of these symptoms on the patient's quality of life. And one of the ways we can do that is to use the International Prostate Symptom Score, which I'll go into a little bit of detail in a moment. We should screen for associated features such as hematuria. The second case illustrated that quite well. Ask for suprapubic pain or perhaps colicky pain, which could be an indication of a bladder stone or a kidney stone. It's important to ask for past medical history, listed whether the patient uses caffeine or excessive or large amounts of alcohol, and whether they've had any urological encounters in the past, either in clinic or maybe they've had some surgeries or investigations performed. Importantly, medications such as anticholinergics and antihistamines and bronchodilators can exacerbate these symptoms. So it's important to keep an eye out for these in a medication history. And then there are three main examinations that are key really in these situations. And that's an abdominal examination, allowing you to rule out a suprapubic swelling, which could be an enlarged and full bladder, which would be dull to percuss. You should examine the external genitalia to look for any abnormalities, anything unusual. And is important, especially in men, to perform a digital rectal examination, which gives you a good idea of the size of the prostate and can also hint at the pathology causing the symptoms. And we'll get into that in a little bit later.
Sorry, Anthony, I was just going to interrupt you there.
Yeah.
So we have a question from Rhiannon McLeod about the question that we had up. If you could just put that back up.
Yeah.
So they were asking, why is transitional cell carcinoma less likely than carcinoma in situ?
That's a really good question. I believe that the transitional cell carcinoma doesn't often manifest with suprapubic pain. I'm not 100% sure, but carcinoma in situ is the most likely one to be related with specifically suprapubic pain and hematuria.
That's great. Okay, thank you.
So the International Prostate Symptom Score is a tool that we can use to assess the impact of lower urinary tract symptoms on the quality of lives of patients. On the right-hand side, you can see the scoring system. It's essentially a set of questions, and patients are asked to give a score from 0 to 5. And you count up the points, and then the sum of the points gives you an idea whether the symptoms are mild, moderate, or severe. There was a systematic review, however, that came out a couple of years ago that said that this scoring system alone is not good enough to diagnose bladder outlet obstruction. So meaning that just because you score highly doesn't mean that necessarily this is a bladder outlet obstruction. And that's because there are all these conditions that we mentioned that could be causing them. However, it's a really good tool to assess quality of life on patients. And also with progression of the disease, of the disease causing these symptoms and management initiated, you can perform the score multiple times to assess if there's any change, if there's improvement or worsening, or the situation hasn't changed at all. So how to investigate a patient with such symptoms? You should do a full set of bloods, especially including a full blood count, which could hint at a luring infection if the white cells are raised. Usinese are important to rule out an AKI. For instance, an enlarged prostate could be a cause of a post-renal AKI. And it could be useful to perform a prostate-specific antigen test